What's up, guys? Thanks so much for stopping by the channel and checking in. And don't forget to click like and subscribe to the channel for more videos. Today I wanted to get on here and talk a little bit about health insurance. I know we're all paying attention to the case with Luigi Mangione, the guy who's accused of killing the United Healthcare CEO. But I think the real question is, why is everybody so irritated with their health insurance? A lot of people are surprised by the amount of support that Luigi Mangione is getting from the public. There's a lot of people angry about these insurance companies, and I want to talk about insurance, actually what it is, and some of the problems that people have with it, and some things that you could do to try to kind of mediate or mitigate those issues that you might have with your health insurance. So what exactly is health insurance? Health insurance is kind of a way to protect yourself against unexpected medical issues. In exchange for a premium or a monthly payment that you make to the insurance company, they will cover the cost or a percentage of the cost of the treatments that you might need. So they'll pay for, doctor's visits or stays at the hospital, medications they might need, procedures they might need to do, things like that. So you kind of split the cost of that, because we all know healthcare, these procedures and these things at the hospitals and stuff may cost a lot of money. Healthcare is not cheap. We all know that. There are a few terms that I think some people get confused when they're trying to understand what their insurance is. So, for example, a deductible. Deductible is the amount of out-of-pocket cost that you are going to have to pay before your insurance even starts to pay for anything that you might need. So usually you have to cover that, and in a lot of insurance plans it's pretty high. One thing that can help if you have the high deductibles is looking into whether or not your plan has an HSA. A HSA is a health savings account, and it allows you to take money out of your paycheck, and it goes into this account. But it goes into a account that's specifically used for medical expenses. So if you have to pay a portion of whatever service you're getting, sometimes you can pull that money out of the HSA, and that'll cover whatever your portion is after the insurance company has paid what they're going to pay. And it's very helpful. I have an HSA, and it has helped me a lot, because most of the time you don't have that kind of cash sitting around in an account. So definitely check and see if you can get an HSA with your plan. Then you have a copay. So a copay is going to be a charge that you have to pay for specific services that you get. For instance, like if you go to a doctor's visit, there's usually a $15 or $20 copay that you got to pay up front before you can have the visit. And then there's something called co-insurance. So co-insurance is actually the percentage of cost that you share with the insurance company. So after you pay your deductible. So for example, if you have a $1,000 deductible and a 20% co-insurance, you have to pay the $1,000 deductible first. And then after that, the insurance may cover like 80% of any remaining cost. And then you have to pay the other 20%. So that would be what the co-insurance would be. Even though you had to pay all that money out of pocket for the deductible, you still have to pay something on your medical costs, which is ridiculous, but that's what they do. So how does the insurance actually work? Well, first of all, there's multiple types of plans that you can enroll in. So you got to make sure you do your research on each plan before you enroll in one, and make sure that it's going to work for you. Some examples are HMOs, PPOs, EPOs, and HDHPs, which I've never even heard of. So make sure you research each one of those and figure out which one you want to sign up for. And then most of these plans, or pretty much all of them, have networks of providers that they use. So there's in-network providers that you can use, and then out-of-network providers. You can go to either one you want, but the in-network providers are going to be cheaper because they have negotiated contracts with the insurance companies for pricing on the services provided. and out-of-network doctors don't. So you're going to be responsible for most of the cost for any provider that's out-of-network. Okay, so now I'm going to get into some of the problems that people have with their health insurance. And I think this is a big reason why a lot of people are giving this Mangione guy so much support, because they can understand his frustration with the insurance company. And let me just say, I don't condone any kind of taking anybody's life because you're upset about something for any reason. The only way that would be acceptable to me is if you're trying to defend yourself. Then it's understandable. But the frustration with the insurance company, I understand. And I know a lot of y'all understand it too. And I think the biggest problem that people have with insurance companies are the denials of their claims. It goes with how healthy you are. For people who are relatively healthy, they don't really use their insurance that much, and if they do, it's not for real severe situations. So the insurance companies are not having to shell out a lot of money for you. But if you're somebody that has, chronic health issues, serious health issues, they're going to have to pay more money for you, and they are constantly looking for ways to make more money for their shareholders, which means they're trying to cut costs and trying to not pay for as much as possible. If you do have a claim that winds up being denied by your insurance company, you can always go through your explanation of benefits, and usually that'll tell you why they denied the claim in the first place. And then you can contact the insurance company too to get clarification on that if you need it. And in some cases, you may be able to file an appeal. You or your doctor might be able to appeal the denial. And in some cases, that gets reversed once it's been discussed between the provider and the insurance company. So I would definitely use that avenue too if you've had a claim denied for any reason. Another problem is the high deductibles. Deductibles on a lot of healthcare plans keep going up. They're making you pay more and more when it comes to paying the cost of your services. It's like they're always just trying to pay less. No matter if they can get you to pay more and get out of doing something, they will. But they want them premiums every month on time though, right? If you don't pay that premium, they're sending you a message, hey, we didn't get your payment. Another problem is the bills too. I don't know about you, but I've had plenty of situations where, I go to a doctor's appointment and then 2-3 months, I got like 2 or 3 different bills coming from a lab, from a doctor, from a hospital. The bills can be confusing, and when you try to read them, I don't do medical coding. I don't do any of that. So most of us don't even understand what the charge is and what they're billing us for exactly. So it can be confusing, but there are some things that you can do to try to kind of mitigate the situation. One thing is to take advantage of the services that they cover for free, like annual exams. If you can go and get your annual exam and get things noticed ahead of time, it could prevent a lot of heartache with insurance later on down the line. Physicals, yearly physicals, mammograms, prostate exams, all these things that are considered preventative care. Insurance companies will cover a lot of the cost of those, especially if you're an older person. Like once you get over 40, you should probably be going to get that stuff done every year. Also, make sure that you don't want to just blindly go with the same insurance plan every year. Shop around and look at different plans and see if you can do better on deductibles and things like that, because every plan is not going to cost exactly the same. Some plans offer more for less, and not vice versa, but different plans offer different benefits for different costs, and they fluctuate. So you want to check that and make sure you're getting the best possible cost for what you think you're going to need, your medical needs are going to be. And also, whatever you don't understand in your insurance, check with your insurance company and have them explain it to you. If you don't understand something, don't just blindly be like, oh, well, whatever, because it could cost you money in the long run. So try to go through your plan, and anything that you don't understand, call your insurance company and talk to them about it and have them explain it to you, so you know what you're getting and what your responsibilities are going to be. So hopefully this video was helpful to you in some way when it comes to using insurance and figuring it out. If you liked it, don't forget to give it a thumbs up and click like and subscribe on the channel for more videos. Oh, and if you have any questions, or if you have some tips or suggestions that you could suggest to the rest of us, put them down in the comments below and we can share them with everybody. And I will see you next time. Thanks again for watching. Bye.